Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic that concerns millions worldwide: diabetes emergencies. Whether you're living with diabetes or know someone who is, understanding the signs of a diabetic emergency is paramount. So, in this video, we'll walk you through the 7 diabetes emergency signs you absolutely need to know. Let's jump right in. 1. Severe hypoglycemia. Hypoglycemia happens when blood sugar levels are too low, usually below 70 mg per deciliter, milligram per deciliter. Without treatment, such low levels of blood sugar can lead to seizures and become life-threatening. It is a medical emergency. However, it is easy to put right in the short term as long as a person recognizes the signs. Hypoglycemia can occur for many reasons, but, in diabetes, it usually stems from the use of insulin or other medications that control blood sugar. Blood sugar levels may drop dangerously low when a person takes more insulin than they need for their current food intake or exercise levels, consumes too much alcohol, misses or delays meals, does more exercise than they expected to do. Early warning signs. The warning signs of hypoglycemia include confusion, dizziness, and nausea, feeling hungry, feeling shaky, nervous, irritable or anxious, sweating, chills, and pale, clammy skin, rapid heartbeat, weakness and tiredness, tingling in the mouth area, headaches, seizures, coma or loss of consciousness, weight loss if hypoglycemia persists. If a person tests their blood sugar levels when they experience these symptoms, they may find that they are below 70 mg per deciliter. If the symptoms appear suddenly, the person should take a high-carb snack to resolve them, such as a glucose tablet, a sweet juice, a candy, a sugar lump. The American Diabetes Association, ADA, recommend the following action. Take 15 grams g of carbohydrate and wait 15 minutes before testing blood sugar levels. If levels are still below 70 mg per deciliter, take another 15 grams of carbs, wait, and test again. When glucose levels are above 70 mg per deciliter, eat a meal. If symptoms persist, seek medical help for any underlying condition. If the person is conscious but unable to eat, someone who is with them should put a little honey or other sweet syrup inside their cheek and monitor their condition. If they lose consciousness, any bystander should call 911 and ask for emergency medical help. If a person experiences regular hypoglycemia despite following the treatment plan, or if changes in blood sugar level occur suddenly in response to a medication change, they should see a doctor. 2. Hyperglycemia. Hyperglycemia is when blood sugar levels are too high because insulin is not present or the body is not responding to the insulin that is present. It can happen if a person with diabetes does not receive treatment. Early warning signs. The person may notice increased thirst, the need to urinate more frequently, headaches, blurry vision, fatigue. Tests will show high levels of sugar in the blood and urine. In mild cases, ways of resolving this include exercising more, eating less, changing the dose of insulin or other medication. However, very high blood sugar levels can lead to life-threatening complications, such as diabetic ketoacidosis or hyperglycemic hyperosmolar syndrome. If symptoms worsen or if a person experiences difficulty breathing or has a very dry mouth, or a fruity smell on their breath, they should see a doctor as soon as possible. 3. Diabetic ketoacidosis, DKA. Diabetic ketoacidosis, DKA, occurs when the body does not have enough insulin to allow glucose to enter the cells properly. The cells do not have enough glucose to use for energy, so, instead, the body breaks down fat for fuel. When this happens, the body produces substances known as ketones. High levels of ketones are toxic because they can raise the acidity levels of the blood. Reasons why DKA might happen include low insulin levels, due to not taking insulin or because another factor stops the insulin from working correctly. Not eating enough. Having an insulin reaction. People with both type 1 and type 2 diabetes can develop DKA. 4. Hyperosmolar hypoglycemic state, HHS. According to the American Academy of Family Physicians, AAFP, hyperglycemic hyperosmolar syndrome, HHS, occurs when blood sugar levels become dangerously high, usually above 600 mg per deciliter. This may happen with or without DKA, and it can be life-threatening. People with poorly controlled type 2 diabetes are more prone to HHS. But people without diabetes, or without diagnosis of diabetes, might experience it. According to the AAFP, the following factors may increase the risk. Infections, including pneumonia, a urinary tract infection, and sepsis. The use of some medications, including some psychiatric treatments and diuretics, which can lead to dehydration. Not following treatment for diabetes. Having undiagnosed diabetes. Misuse of some substances. Having another health condition, such as a heart attack, a stroke. 5. Hypoglycemic unawareness. Some individuals with diabetes may experience hypoglycemic unawareness, where they fail to recognize the early warning signs of low blood sugar. This condition increases the risk of severe hypoglycemia and requires careful management to prevent emergencies. 6. Diabetic retinopathy. Diabetic retinopathy is a complication of diabetes that affects the eyes, leading to vision problems and even blindness if left untreated. Symptoms include blurred or distorted vision, floaters, and difficulty seeing at night. Regular eye exams are essential for early detection and treatment. 7. Diabetic neuropathy. Finally, diabetic neuropathy is a type of nerve damage that can occur due to diabetes. Symptoms vary depending on the nerves affected but may include numbness, tingling, burning pain, and muscle weakness. Proper foot care and regular checkups are crucial to prevent complications such as foot ulcers and amputation. In conclusion, recognizing the signs of diabetes emergencies is vital for timely intervention and prevention of serious complications. Whether it's hypoglycemia, hyperglycemia, or diabetic complications like DKA and neuropathy, being aware of these warning signs can potentially save lives. Remember, if you or someone you know experiences any of these symptoms, seek medical assistance immediately. Stay informed, stay vigilant, and take control of your diabetes journey. Thanks for watching, and don't forget to like, share, and subscribe for more valuable content. Take care, and we'll see you in the next video.